Brothers, have you ever wondered why every time someone brings up a prostate exam, most men shy away from it, even treat it like a taboo? I get it. A lot of people think it's something sensitive, awkward, even shameful. But the truth is far from that. A prostate exam isn't nearly as scary as many believe, and more importantly, it could save our lives. Let me share a very clear number so you understand just how serious this is. 1 in 8 men will be diagnosed with prostate cancer at some point in their lives. But if it's caught early, the survival rate is over 90%. That means a quick checkup, just a few minutes, could determine the next 10 to 15 healthy years of your life. Think about it. We can spend hours playing chess, grabbing coffee, or watching a game. So why hesitate over a short exam that brings peace of mind and a better chance at staying healthy for years to come with your kids and grandkids? Don't let embarrassment or fear stop you from doing something that could save your life. In today's video, I'll walk you through exactly what a prostate exam is, when you should get one, and why it matters so much. You know, I've been a doctor working in men's health for many years, especially when it comes to prostate-related issues. Over the course of my practice, I've seen the same story play out many times. At first, guys are hesitant, they delay the checkup, but once they go through with it and catch things early, they avoid serious complications, and in some cases, even beat early-stage cancer. In this video, I want to walk with you through a simple and honest explanation of the prostate exam. You'll learn why this becomes essential in your 50s and 60s, what exactly happens during the exam, and how to mentally prepare so you feel totally at ease. I won't talk like a textbook. I'll talk to you like I would with friends, fathers and grandfathers who want to stay healthy and enjoy many more years with their families. Before we dive in, I just ask one small favor. If you find this topic important, please hit the like button and subscribe to the Senior Vitality Now channel so you can get practical, easy-to-follow medical advice every week. And don't forget to turn on the notification bell so you never miss a thing when it comes to men's health after 60. Brothers, to understand why a prostate exam is so important, we first need to know what the prostate actually is. It's a small gland located just below the bladder and in front of the rectum. Its main job is to produce fluid that nourishes sperm and supports reproduction. Most of the time, it works quietly, so quietly, in fact, that many men forget they even have one. But once we hit 50, especially after 60, the prostate often becomes a weak spot. There are 3 major issues that commonly arise. The first is prostate enlargement, when the gland grows and puts pressure on the bladder and urethra. This can make urination difficult, cause frequent nighttime trips to the bathroom, and leave you feeling like you didn't empty your bladder completely. The second issue is prostatitis, or inflammation of the prostate, which can cause pain, discomfort, and seriously affect your quality of life. And the most serious of all is prostate cancer. In its early stages, it usually shows no symptoms, but if caught late, it can spread to the bones, causing chronic pain and even becoming life-threatening. I've seen many patients come in too late simply because they thought, I feel fine, so I must be fine. But the truth is, prostate cancer often develops silently. Only regular screenings can detect it early. And as I mentioned earlier, when caught early, the survival rate is over 90%. That means just one simple checkup can protect a whole decade of your future health. So, a prostate exam is not some luxury or unnecessary procedure. It's a safety key, something every man over 50 or 60 can use to stay in control of his health, instead of letting disease make that decision for him. 4. Types of prostate exams. When guys hear about a prostate exam, many immediately think of an uncomfortable procedure. But in reality, there are several ways to check the prostate, and it doesn't always start with the method most men worry about. First, there's the PSA blood test. This is the most common screening method and simply involves drawing a blood sample to measure the PSA level. PSA stands for prostate-specific antigen. When the prostate is enlarged, inflamed, or affected by cancer, PSA levels in the blood usually rise. This test is quick, minimally uncomfortable, and gives doctors a good starting point for assessing risk. However, it's important to know that PSA results aren't always perfectly accurate. Sometimes PSA levels increase due to benign inflammation or an enlarged prostate, without any cancer. That's why doctors don't rely on PSA alone. They look at it along with other factors. The second step is the Digital Rectal Exam, or DRE. This is the part that many men are most hesitant about. but it's actually quick and straightforward. The doctor puts on a glove, applies lubricant, and gently inserts a finger into the rectum to feel the prostate. The goal is to check for abnormal enlargement, lumps, or irregular textures. It may feel a bit uncomfortable, but it only lasts a few seconds. Many of my patients breathe a sigh of relief afterward and say, "That's it? I can't believe I was so worried about this." In some cases, doctors may use both the PSA and DRE together for greater accuracy. If both tests raise concern, additional evaluations may be needed, such as a transrectal ultrasound or a prostate biopsy, where a small tissue sample is taken and examined under a microscope to confirm whether cancer cells are present. But here's what I want to emphasize. Not everyone needs to go straight to a biopsy. Most men only need the PSA test and a simple physical exam. And in the majority of cases, if problems are found early, they can be managed effectively with medication or regular monitoring, without needing more invasive procedures. So don't let exaggerated fear hold you back. Understand that PSA and DRE are basic, safe, and incredibly useful tools for protecting men's health after 50 or 60. 5. What happens during a prostate exam? Detailed breakdown. Dear brothers, when you hear the words prostate examination, most people experience a shared reaction: anxiety, confusion, and even fear. I understand. It's a sensitive procedure involving a part of the body that's rarely discussed. But if we put aside embarrassment and regard it simply as a routine medical checkup, you'll see that the process isn't scary at all. In fact, it's very quick. To give you a clearer picture and help you prepare mentally, I will describe each step in detail, from the moment you walk into the clinic to the moment the visit concludes. 1. Scheduling the appointment and preparing in advance. The process begins when you call or book an appointment through your hospital or clinic. For men in their 50s and 60s, especially if you've experienced symptoms like difficulty urinating, frequent nighttime urination, lower abdominal discomfort, or have a family history of prostate cancer, scheduling an annual exam is highly recommended. Before the appointment, the doctor may advise you to avoid sexual activity, long-distance cycling, or heavy physical work for 48 hours. These activities can temporarily raise PSA levels and lead to inaccurate results. Also, if you're on medications for other conditions, such as diabetes, hypertension, or anticoagulants, be sure to bring a list with their names and doses so your doctor can review them. Regarding diet, generally no special fasting is required unless your doctor specifically instructs it for a combined blood test. Most importantly, maintain a relaxed mindset. Treat this as a normal part of health maintenance. 2. Arriving at the clinic and completing the paperwork. Upon arrival, you will complete registration, fill out medical forms, and answer a few brief questions about your health history. You may be asked, are you experiencing discomfort while urinating? Have you noticed blood in your urine? Are you experiencing pain in your lower back or hips? Does anyone in your family have a history of prostate disease? These questions are essential because they help the doctor assess your risk indicators. At many modern clinics, examination rooms are private and discreet, and medical staff are very experienced and professional. You won't feel awkward or uncomfortable. 3. PSA blood test. The first clinical step in a prostate exam is often a PSA blood test. PSA, or prostate-specific antigen, is a protein produced by the prostate gland. If there are issues like enlargement, inflammation, or cancer, PSA levels commonly increase. The blood draw itself is quick and familiar. A nurse draws a small sample from a vein in your arm, taking less than 1 minute. Results are usually available within a few hours or a few days, depending on the facility. It is important to remember, a high PSA isn't a definitive indicator of cancer. PSA can be elevated due to benign inflammation or prostate enlargement. That's why the doctor never relies solely on PSA results. They combine them with other diagnostic steps. 4. Digital Rectal Exam, DRE. This step is the one that generates the most worry for many men. But right from the start, let me clarify. This procedure is not painful, just a bit uncomfortable and lasts less than a minute. You'll be asked to lie on your side with your knees pulled toward your abdomen, or in some cases, bend slightly forward for better access. The doctor will don a medical glove, apply lubricant, and gently insert one finger into the rectum to palpate the prostate. The goal is to assess whether it's unusually enlarged, feels smooth, or rough. or if there's any suspicious hard nodule. The entire process takes only a few dozen seconds. Many of my patients exhale in relief afterward and say, "I worried about this all month. Turns out it's just this quick." The greatest benefit of a DRE is that it allows doctors to detect abnormalities that may not show up through PSA testing alone. There are cases where PSA is normal, but palpation during DRE reveals a suspicious hard area, which leads to early detection of cancer. 5. After the exam, discussing initial results. Once PSA and DRE are complete, the doctor will sit down with you to discuss the initial findings. If PSA levels are within normal limits and the prostate feels smooth and soft, you may only need annual monitoring. However, if there are any suspicious findings, the doctor may order additional diagnostic steps, such as transrectal ultrasound. TRUS uses a small ultrasound probe inserted into the rectum to gain a clearer image of the prostate. MRI helps detect cancer-suspect regions with high precision. Prostate biopsy. If both PSA and DRE show signs of concern, the doctor may extract a small tissue sample and analyze it under a microscope to confirm whether cancerous cells are present. Remember, not everyone needs to move on to these steps. Most men only undergo the PSA test and a basic exam and are able to manage their prostate health effectively. 6. Psychological aspects of the exam process. A major barrier to getting screened is psychological. Many avoid it due to embarrassment or fear of the procedure. But once they understand each step, the process seems far less intimidating. In a medical setting, the doctor and clinical staff perform this exam routinely. For them, it's entirely normal. No judgment, no awkwardness. It's conducted with full privacy and respect for the patient. Treat the prostate exam like checking blood pressure or screening for colon issues. It's simply a tool for protecting your health. The only embarrassment lies in your own perception, not in the reality of the process. 7. Time investment and long-term benefits. Typically, a prostate exam appointment takes 15 to 20 minutes total, including check-in, testing, and conversation with the doctor. The part that causes the most worry, the DRE, actually lasts less than a minute. Yet the peace of mind it provides can last an entire year. Research has shown that men over 50 who keep up with annual screening have a 2 to 3 times higher chance of detecting prostate cancer early. And when detected early, the 10-year survival rate exceeds 90%. These statistics are too significant to ignore. 8. A real patient example. I remember a patient, Mr. Hung, aged 68, living in Hanoi. He had always been healthy, but started experiencing persistent nighttime urination. After much reluctance, he agreed to be screened. His PSA was elevated, and the DRE revealed a small hard nodule. A biopsy confirmed early-stage prostate cancer. Thankfully, due to early detection, treatment was successful. 5 years later, Mr. Hung remains healthy, regularly spending afternoons playing with his grandchildren. He once told me, "If I hadn't gone in for the exam that day, I might not be sitting here now." His story is a powerful reminder that a simple exam can truly be life-changing. 9. Final thoughts. The prostate exam process isn't complicated. It involves arriving for your appointment and filling out forms, undergoing a PSA blood test, having a digital rectal exam, DRE, discussing results, potential follow-up tests if needed. The entire experience takes only a few dozen minutes, but its impact lasts a lifetime. Don't let embarrassment or fear stand in the way of taking care of your health. For men over 60, getting screened isn't just a personal responsibility. It's a priceless gift to your family and descendants. 6. Advice for men over 50 to 60. Reaching your 50s and 60s is like hitting a major turning point in your health. Many things in your body don't run as smoothly as they used to, and the prostate is one of them. So, the first and most important piece of advice I can give is this. Treat your prostate exam as a routine annual checkup, just like checking your blood pressure, heart, or blood sugar. If you stay consistent, you'll always be in control of your health, not caught off guard by sudden problems. Especially if you're in a high-risk group. For example, if your father or brother had prostate cancer, or if you're of African descent, you should get screened earlier and more frequently. Your risk could be 2 or even 3 times higher than average. Alongside getting checked, I want to share a few habits that help keep your prostate healthy. Cut down on red meat and fried, greasy foods. Instead, add more leafy greens, tomatoes, soy, and omega-3 rich fish to your diet, all of which have been shown to lower the risk of prostate enlargement and cancer. And don't forget exercise. Even brisk walking for 30 minutes a day can boost blood circulation, reduce inflammation, and support prostate health. Finally, maintaining a healthy weight and getting enough sleep are often overlooked, but they directly affect your hormones and overall male health. I've seen many patients improve urinary symptoms like frequent or difficult nighttime urination just by changing a few simple habits. Put simply, you have two layers of protection. One is regular screening, and the other is daily lifestyle care. When you combine both, you're not just preventing disease, you're also catching it early if it ever appears, and setting yourself up for long-term health well beyond your 60s. 7. Addressing common fears. I know there are three main reasons why many men hesitate when it comes to getting a prostate exam. First, fear of pain. But in reality, the procedure isn't painful at all. The PSA blood test feels just like any other blood draw. And the digital rectal exam, the DRE, might feel a little unusual or cause slight pressure for a few seconds, but that's it. It's no different than any other quick medical checkup. The second reason is embarrassment. Many men think, how can I let a doctor do that to me? But I want to emphasize, for doctors, this is a completely routine medical procedure, just like checking your blood pressure or listening to your heart and lungs. No one is judging you, no one's laughing. Everything happens in a private, respectful setting. The embarrassment is only in our own minds. In medicine, this is just another normal part of caring for your health. And finally, the big question, is it really necessary? This is the most important one. Prostate cancer in its early stages usually has no obvious symptoms. Many men don't realize anything is wrong until they're urinating blood or dealing with bone pain. And by then, it's often in a late stage and much harder to treat. If you wait for symptoms, it might already be too late. That's why routine screening is the only reliable way to know if something's wrong. Put simply, a prostate exam isn't a luxury or something you do just to check a box. It's your shield. Your way of knowing your health is still in your hands. Brothers, throughout today's video, we've seen a clear truth. The prostate may be small, but it plays a big role in a man's health after the age of 50 or 60. A prostate exam is not something to fear, and definitely not something to be ashamed of. It's a quick, simple procedure that could literally save your life, help you avoid serious complications, and give you more healthy years to enjoy with your children and grandchildren. Remember, the exam only takes a few minutes, but in return, it gives you peace of mind for an entire year. Don't wait. Don't let fear or embarrassment cost you the chance to catch problems early and treat them in time. If today's video helped you understand more and feel motivated to take better care of your health, give this video a like. And don't forget to subscribe to the Senior Vitality Now channel and hit the notification bell so I can keep bringing you practical, easy-to-follow medical advice every week. And I'd love to hear from you. Have you ever had a prostate exam? What was your experience like? Share it in the comments below so we can all learn from and support each other. Your health after 60 is one of your most valuable assets. Protect it, starting today.